Thank you very much, Dr. Walensky. I'd like to spend the next couple of minutes in addressing a much underutilized intervention for COVID-19, and that is the use of monoclonal antibodies for the treatment and prevention of SARS-CoV-2 infection and COVID-19 disease. Next slide. For those not totally familiar with this, monoclonal antibody is an antibody that's produced by a single clone of B cells or a cell line and consists of identical antibody molecules that can actually be produced in the in vitro situation in unlimited quantities. Next slide. If you look at the virion on the upper left part of the slide, and you look up the blown up spike protein, the red molecule on the right upper panel, when you talk about polyclonal antibodies, which result from infection or vaccination, it's a group of antibodies against every aspect of the spike protein, which is the good news. However, the concentration and the affinity of those antibodies can be markedly improved if you get a single cloned antibody, hence the word monoclonal, that's against a very specific part of the spike protein that can have a major effect in prevention and treatment. Next slide. So let's look at what we have. We have 3 anti-SARS-CoV-2 monoclonal antibody products that have currently had emergency use authorization from the FDA. And the EUAs here are for adults and children 12 years of age and older who weigh at least 88 pounds. There are 3 of them. There's the Lilly product, the bamlanivimab plus etesevimab. There's the Regeneron product referred to as RegenCov. And then there's the GSK and Vir product. Each of these products targets the spike protein of SARS-CoV-2. Next slide. So you can do an indication for these antibodies that are twofold. The first is to treat infection with SARS-CoV-2. Next slide. And in this regard, clinical trials have demonstrated that early treatment with anti-SARS-CoV-2 monoclonal antibodies can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. It is important to emphasize that this must be done early in infection and not wait, of course, until a person is sick enough to be hospitalized. That's when you get the best effect. And again, being an underutilized intervention, we want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. Next slide. Now, if you look at the people who should benefit from this, this is a list from the FDA and the NIH treatment guidelines about all of the people who may have significant benefit from this type of therapy if given early in their infection. I'm not going to go through each and every one of them, but as you can see, there are a number of conditions on this slide that could benefit from the monoclonal antibody treatment after infection. Next slide. But there's also the benefit of prevention using monoclonal antibodies. Next slide. And we know now that the FDA, just a couple of weeks ago, authorized the Regeneron monoclonal antibody for post-exposure prophylaxis, namely for the prevention of COVID-19 after someone has been exposed to a documented case of SARS-CoV-2. And even now, and I won't show the data because of lack of time, there are now studies in pre-exposure prophylaxis as well as other studies in treatment. So I'll have on the last slide, next slide, the treatment guidelines panel. We can give you all the information and it's accessible on the website shown here. And for physicians, patients, and others who want to know how you can get monoclonal antibodies administered, this is the call center, and this is the online way to approach it. So bottom line is, this is a very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest. Back now to Vivek Murthy.